Intravenous fluid therapy is a cornerstone of modern medical care. It provides a vital route for delivering essential substances directly into a patient's bloodstream. This method bypasses the digestive system, allowing for rapid absorption and immediate effect. Many patients in hospitals and other healthcare settings rely on IV therapy for various reasons. These reasons range from simple hydration to the administration of life-saving medications. Understanding the importance of IV fluids is fundamental for every nursing student. It forms a significant part of daily nursing practice and patient well-being across numerous clinical scenarios. The ability to administer fluids intravenously is a critical skill for nurses. It allows healthcare professionals to manage a patient's fluid balance precisely. This is particularly important for individuals who are unable to take adequate fluids orally. Such patients might include those who are unconscious, nauseous, or have swallowing difficulties. IV therapy can also be used to correct electrolyte imbalances, which can have serious consequences if left untreated. Therefore, a nurse's proficiency in IV fluid management directly impacts patient recovery and stability. Careful assessment and monitoring are key components of this responsibility. IV fluids serve multiple purposes beyond basic hydration. They are a primary vehicle for delivering medications. Many drugs, such as antibiotics or chemotherapy agents, are most effective when given intravenously. This route ensures consistent drug levels in the blood. Furthermore, IV therapy can provide nutritional support. Patients who cannot absorb nutrients through their gut can receive total parenteral nutrition, or TPN, intravenously. This supplies all the necessary calories, proteins, fats, vitamins, and minerals. This ensures the patient receives adequate nourishment to support healing and recovery. Effective IV fluid therapy hinges on a nurse's knowledge and diligence. Nurses are responsible for initiating IV access, maintaining the infusion, and monitoring the patient's response. They must understand the different types of fluids and their specific uses. They also need to recognize potential complications and intervene promptly. This guide aims to provide beginner nursing students with a foundational understanding of IV fluids. It will cover the types of fluids, their administration, and common issues. This knowledge will build a strong base for safe and effective nursing practice in this essential area. Intravenous fluids are broadly classified into two main categories: crystalloids and colloids. Crystalloids are solutions containing small molecules, such as electrolytes and glucose, dissolved in water. These small particles can easily pass from the bloodstream into the body's cells and tissues. This characteristic makes them useful for rehydration and electrolyte replacement. Crystalloids are further divided based on their tonicity relative to body fluids. Tonicity refers to the concentration of solutes in the solution. Understanding this classification is vital for selecting the appropriate fluid for a patient's specific needs. Isotonic crystalloid solutions have a solute concentration similar to that of human plasma. This means they do not cause significant fluid shifts between the intravascular space and the cells. Common examples include 0.9% sodium chloride, also known as normal saline, and lactated Ringer's solution. Normal saline is frequently used for volume expansion in cases of dehydration or hypovolemia. Lactated Ringer's contains multiple electrolytes such as sodium, potassium, calcium, and lactate, closely resembling the electrolyte composition of blood. It is often preferred in surgical patients or those with burns to help restore fluid and electrolyte balance. Hypotonic crystalloid solutions have a lower solute concentration than plasma. When administered, they cause fluid to move from the bloodstream into the cells, causing cells to swell. An example is 0.45% sodium chloride, often called half-normal saline. Hypotonic solutions are used to treat conditions like cellular dehydration, where cells have lost water. They can also be used for maintenance hydration when electrolyte replacement is not a primary concern. However, they must be used cautiously as they can cause a rapid shift of fluid into cells, potentially leading to complications like cerebral edema if not monitored carefully. Hypertonic crystalloid solutions, conversely, have a higher solute concentration than plasma. These solutions draw fluid from the cells and interstitial spaces into the intravascular compartment. Examples include 3% sodium chloride or 5% sodium chloride. Hypertonic saline solutions are used in specific clinical situations such as severe hyponatremia or low sodium levels, or to reduce cerebral edema or brain swelling. Their administration requires very careful monitoring due to the risk of fluid overload and rapid changes in electrolyte levels. Colloids, the other major category, contain large molecules like proteins or starches that do not easily pass out of the bloodstream, keeping fluid within the vascular space for a longer period. Examples include albumin and Hetastark. They are used for rapid volume expansion in critical situations like shock. Administering intravenous fluids requires meticulous attention to detail and adherence to established protocols. The process begins with verifying the healthcare provider's order. This order must clearly state the type of IV fluid, the volume to be infused, the rate of infusion, and the duration of therapy. It is crucial to double-check these details to prevent errors. Once the order is confirmed, the nurse gathers all necessary equipment. This includes the correct IV solution bag, an appropriate infusion set, an IV catheter of the correct gauge, alcohol swabs for disinfection, sterile dressings, tape, and clean gloves for personal protection. Patient preparation is a key step. The nurse must correctly identify the patient using at least 2 identifiers, such as name and date of birth. Explaining the procedure to the patient in simple terms can help alleviate anxiety and gain their cooperation. It is important to answer any questions the patient may have. Hand hygiene is paramount before any patient contact and before donning gloves. Selecting a suitable vein is a critical skill. The nurse should assess the patient's veins, considering factors like vein size, condition, location, and the type and duration of IV therapy planned. Distal veins on the non-dominant arm are often preferred initially. The actual insertion of the IV catheter must be performed using a septic technique to prevent infection. The selected site should be cleaned thoroughly with an antiseptic solution, typically an alcohol or chlorhexidine-based wipe, and allowed to air dry. The catheter is then inserted into the vein at an appropriate angle. Once a blood return or flashback is observed, the catheter is advanced and the needle is withdrawn. The catheter is then secured with a sterile dressing and tape. The infusion set, which has been primed with IV fluid to remove air, is connected to the catheter hub. The infusion rate is then set, either manually using a roller clamp or with an electronic infusion pump. Continuous monitoring is essential throughout IV therapy. The nurse must regularly check the IV insertion site for signs of complications such as redness, swelling, pain, or leakage. The flow rate should be monitored to ensure the fluid is infusing as prescribed. The patient's overall response to the fluid therapy also needs careful observation, including vital signs, urine output, and signs of fluid overload or dehydration. All aspects of the IV therapy, including the type of fluid, rate, site, and patient's response, must be accurately documented in the patient's medical record. This documentation ensures continuity of care and provides a legal record of the treatment. Despite careful technique, complications can sometimes arise during intravenous fluid therapy. One common issue is infiltration. This occurs when the IV catheter dislodges from the vein and the IV fluid infuses into the surrounding subcutaneous tissue instead. Signs of infiltration include swelling at the IV site, coolness of the skin, pain or discomfort, and a slowed or stopped infusion rate. If infiltration is suspected, the nurse should immediately stop the infusion, remove the catheter, and elevate the affected limb. Applying a warm or cold compress, depending on the type of fluid infiltrated and local policy, may help reduce discomfort and swelling. Another potential complication is phlebitis, which is inflammation of the vein. Phlebitis can be caused by mechanical irritation from the catheter, chemical irritation from the IV fluid or medication, or infection. Symptoms include redness, warmth, tenderness, pain along the vein, and sometimes a palpable venous cord. If phlebitis occurs, the infusion should be stopped and the IV catheter removed. A warm compress applied to the site can help relieve symptoms. The IV line will need to be restarted in a different location, preferably in the other limb or a more proximal site on the same limb if necessary. Fluid overload, also known as circulatory overload, is a serious complication that can occur if IV fluids are administered too rapidly or in excessive amounts. This is particularly a risk for patients with cardiac or renal impairment. Signs and symptoms include shortness of breath, rapid breathing, a cough producing frothy sputum, distended neck veins, increased blood pressure, and edema or swelling in the extremities. If fluid overload is suspected, the infusion rate should be slowed immediately to a keep vein open or KVO rate. The patient should be placed in a high Fowler's position, and the doctor must be notified urgently. Oxygen therapy may be required. To minimize complications and ensure patient safety, nurses must adhere to best practices. Always perform thorough hand hygiene and maintain strict aseptic technique during IV insertion and site care. Regularly assess the IV site and the patient's overall condition. Ensure accurate calculation and programming of infusion rates. Educate patients about the signs of complications and encourage them to report any discomfort. Meticulous documentation of all IV-related procedures and observations is crucial. Continuous education and skill refinement in IV therapy techniques are essential for all nursing students and practicing nurses to provide the highest standard of care for their patients.